Hi everyone, Dr. Rich Castellano, the Smile Doctor. Happy St. Patrick's Month. We're here today with Susan, and we're going to do a little lip plumper. And Susan was very specific. She said just a little bit in the lips. So here's what I found for the lips. Some people, they either want to treat, they don't want to touch anything at all, or they want to treat the little creases around the mouth and no lip plumping, or they want a little lip plumping, but don't treat the creases, or they want both, or they want maybe a little more lip plumping. So here's, yeah, we can turn this off. Here, take a look at her pictures. We got her before pictures here. So you can see we're going to fill as many creases as possible, plump the lips. It's going to look natural, and then come back over to Susan here. So you told your husband, he's supportive.
He is.
Very good. And it's been how long ago since you had lip plumper?
It's been at least 4 or 5 years.
How did they do the last time you had it done?
Well, they
You mentioned some bruising.
Yeah, they massaged it in a whole lot, and it bruised really bad.
Okay.
I had bad bruising.
So bruising can happen from the lips. Usually it's not too bad from what we do. I'll do my best to avoid it. And it's not so much the massage that may make the bruising, but the injection. So she's not on any blood thinners. We're going to do the numbing medicine. And with the lidocaine, with the epinephrine, it causes the blood vessels to shrink. My goal is that you have less bruising from that. So that's what we're going to do. Any questions? Okay, very good.
Okay.
So for the physicians and students that are watching, I like to use the Hiba Cleanse, and let me have you rest your head all the way back, and alcohol to just cleanse on the skin. It's very rare to get an infection after lip filler, but we always do that. It's also rare. Some people are prone to cold sores, fever, blisters. It's very rare that that happens from lip filler. But if they do, you can put people on antivirals. It just depends on the patient's history, and that's not an issue here today. So cleansing with the alcohol, and then I do like to dry the alcohol because it can burn when you're injecting with the alcohol. So now I'm going to grab my buzzer. Okay, so I'm going to have you rest your head all the way back. So we use a lidocaine here. This is a modified dental block. I'm going to lift your lip, and you're going to feel buzz, and then pinch on 3. 1, 2, 3, pinch. You feel small, medium, big pinch, not too bad. So you might feel a little pinch here. So the modified dental block, or the oral mucosal block here, really numbs the lips well. If you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. Bellatero does a good job for the fine lines and also some plumping in the lips. I do have some patients that want enough plump in their lips that they'll do more than 1 syringe, but usually 1 syringe is enough. Everything's looking good.
Diane says, for a very saggy chin and neck, what would be the best treatment?
For chin and neck?
Saggy chin and neck.
Well, right, we can do tightening procedures. The best next step is you need a consultation, but lifting procedures under local anesthesia do a great job for that. Susan, you feel big pinch, little pinch, not too bad here?
Little.
Everything's looking good. There's no restrictions after we do the lip plumper. So yes, we can tighten the neck and jawline, and we are on a mission to stop bad plastic surgery. I like to go over my ABCs of plastic surgery. When you know the ABCs, you will make your best decisions because you know the bigger picture. A stands for area. There are 4 areas that we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots, you doing okay? We can polish and repair the skin. Go ahead and close your mouth. The 4th area is better than everything else. 1, 2, 3, pinch. And that's our behavior, little pinch. Nothing looks as good as Mother Nature's free facelift when we smile. And Susan knows the power of smile. She's a great smiler. But the smile outdoes any treatment that I'll ever do. None of our treatments look as good as the smile. And the smile is our model of what we want to recreate. In the facial anatomy, plumping the cheeks, it tightens the lips, improves the lip lines. Everything's looking good. So just go nice and slow. It takes a couple of minutes to do the modified dental block or the oral mucosal block here, but the results are far superior. And now I'm going to test that area with some additional numbing. Go straight into the sharp container. So I'm going to lift your lip here. Now, do you feel a little bit of a pinch here? Not too bad?
A little.
So I'm a little extra numbing here. You can see she has a little bit of pigmentation in the lip. That can be very normal. Usually you pass the grocery store test with the lip filler the same day. You walk into the grocery, no one does a double take. Little pinching here and little pinch. Little pinch here. Everything's looking good. Pinch. And then a little bit in the corners of the mouth. You can close your mouth for me. 1, 2, 3, pinch. Sorry, pinch. And on the other side. 1, 2, 3, pinch. So the 4 areas: tightening, volume, skin, and behavior. ABCs. B stands for boundaries. What are the rules for good plastic surgery? Safety is always first. You must look natural. We want to prevent future aging, and let's get as much improvement as possible. I tell patients we can't make things perfect. We're not God. We do the best we can. And if we need to come back another day and do more, it's better than going too far. So those are the B for boundaries.
Does it look the same?
Say again?
Does it look the same?
So you're a little numb and swollen. So this is just the numbing medicine, right? So just the numbing medicine. And that goes away 100%. But the lips are going to feel goofy. And they're pub, but they're swollen. So, but this way it's much easier. Some patients will say, I did lip filler somewhere else. It was so painful. Should not be painful. You might feel just little pinches here and there. Now, how about here? Do you feel a little pinch? Not too bad? So, C stands for combination treatment. If we want our best results, we combine. We combine tightening, volume, and skin to get best results for our facial treatments. If you want your best results, but you only want to do one treatment, then we talk about laser or lifting. If we want our best results with no downtime, then fillers. Now, fillers do a great job, but they don't give us a lift or laser results. In lifting, I get wonderful, and laser, I get wonderful outcomes, but I can do even better when I combine. So if you know those 3 categories, combination, solo treatment, and then fillers, no downtime, you have an idea of what's going to be right for you. So I'm just filling that little crease. This is an intradermal injection.
Mary Colonna asked, what is the cost for the lip fillers?
So look us up at imagelift.com/pricing, or you can, they do have some specials through the team. Give us a call, 813-463-9245. And some people will decide, lip filler's not right for me, I want to do a laser. Or it's better to have a plan first before you get your pricing. The most expensive lip filler is done by the inexperienced injector, because then it has to be redone, or it just doesn't look good and you wasted your money. So you want to have it done the right way, that's for sure. Everything's looking good. How are you feeling, Susan?
Pretty good.
Perfect. It's normal we get this little bitty ridge under the lip here, so we're just filling that area in. Perfect. So now I'm going to do a little bit of plumping. I'll use 0.1 cc's in each quadrant, upper, lower, right, left quadrant. Just a tiny bit, and as you can see, there's very little significant bleeding, but you can see how it just plumps those areas up very nicely. Very good. Susan, how are you feeling, dear? Doing okay?
Yep, okay.
Everything's looking good. Now, so C's for combination. D is different perspective. Of course, we never see ourselves the same way that other people see us, which is interesting because we're looking at the same thing, but we definitely do not see it the same way. Because when we look at other people, we look at them socially. But when we look at ourselves in the mirror, we do not look socially. We look seriously, and we can be a little hard on ourselves. And that's the reason people go too far. If we're too hard on ourselves, we look at ourselves too closely, you don't have the right doctor to protect you, that's where people get into trouble. Everything's looking good. Now, of course, we tell patients you don't want to taste the chocolate cake before it's done baking. Susan will see her result today, and you can see it just plumping up there nicely. But she'll have a little bit of swelling that's going to settle, and then the hyaluronic acid in the filler is going to absorb water, and that's going to even out her results. So she'll pass the grocery store test today. Family and friends aren't going to figure out she had it done. When the numbing settles, she'll be able to use her lips normally. There's no restrictions. Now, what I'm going to do is I want to show Susan what we've done so far, and hold this for me. Now, the lips are a little numb, but can you see how it plumps a little bit? And we treated some of the creases. Do you think you want a little more plump, or leave the plump as it is, and then I'm just going to work on some outside creases? How do you feel?
I'm good. Good.
So I'll leave the plump the way it is, and then I'm going to work on some of the creases. Is that what
Okay.
you're thinking?
Mm-hmm.
Okay.
How long does the numbing last?
About an hour, 30 minutes to an hour. 30 minutes to an hour, it will go away. Right? And so now I'm going to work on a few of these little extra creases we have around the corners of the mouth.
Feels so funny.
Feels goofy, but it looks really good. The corners of the mouth are an important place to treat because we get that downturn, and this will help to uplift that area. Of course, when we smile, that's the best cure for the downturn of the mouth. But it's really important that you share these videos. We are on a mission to stop bad plastic surgery. People are getting into trouble out there all the time because they don't know the right things to do. Now, you'll feel a little pinch here. But if you do it the right way, people are aware, they're going to make better choices when they know their options. Little pinch, 1, 2, 3, pinch. Pinch. Very good. One, two, three, pinch. Got a deeper crease here so we can feel that. And every time she smiles, she's going to deepen these creases. Pinch.
Do you do procedures a day as a visit?
Do we do them today? What day?
The same day visit?
Yes, we can. Absolutely. You just have to let my team know you want to do it the same day.
And
It's better to start with the consultation.
And which filler are you injecting with?
This is the Bellatero hyaluronic acid. Okay, so we're completely done. Hopefully that wasn't too bad. So let's take a look now. So we got a little bit of plump to the lips. Now when I massage, you don't have to be too vigorous, but it's not a bad idea to do just a little bit of a massage like this, just to soften things out. We did the corners of the mouth and some of the creases. How does it look so far?
Good.
It's not overdone. She can put on lipstick, no restrictions. Her family and friends won't figure it out in about 6 to 8 weeks. We like to take some pictures, before and afters. That way we'll put the picture side by side and you can see where your results are. If we're happy, we leave it. If you want to add more, we can. Any questions?
Nope.
Okay. Congratulations. I give you the hugs and hugs. It feels goofy
Thank you.
when the lips are so numb. But thank you all for watching. We're on a mission to stop bad plastic surgery. I am Dr. Rich Castellano, the Smile Doctor. We're here to help you raise your standards. Happy St. Patrick's Month. We're going to celebrate all month long. We'll see you in the next video.